treatments, basically, the first line treatments are all the non-operative things that you can do to help minimize symptoms. You can't really stop the disease process or reverse it, but you can help minimize the symptoms, the pain and the stiffness that's caused by that. Typically, Tylenol, as well as an anti-inflammatory like Motrin, Advil, Aleve, something like that. Sometimes doing a little bit of icing or a little bit of moist heating. Physical therapy and some general range of motion and strengthening exercises is important to help treat the symptoms of that. The next kind of steps would be things like wearing a brace. So we think about doing a cortisone injection into the knee that can help really minimize the pain and inflammation, at least temporarily for a while. The next order of business treatment-wise would be knee replacement. That's kind of end of the road. When your symptoms are bad enough, they really restrict your ability to do what you need to do, what you want to do, and take the fun out of life, so to speak. I mean, it's time to really consider knee replacement. And that's where we remove a small amount of bone and replace that bone with metal and plastic. There's no nerves in metal or plastic. Metal and plastic can rub on one another without pain as long as the bone is covered by the metal and the plastic implant. The nerves in the bone are happy again and they're no longer causing the pain. So this is a model of a knee replacement. It's actually the type that I prefer, which is conformis. It's actually the only knee replacement on the market that has a totally custom option. It uses a CAT scan preoperatively, and the CAT scan shows the three-dimensional data into the computer of the bone. And then they actually can build the implant specifically to match your anatomy. So the exact size and shape and curvature of your anatomy is duplicated, make a metal and plastic knee. Just like fingerprints, genetic makeup, there's only one person with the same type of knee, and that would be you. It's kind of artificial to boil everybody's knee down to like 12 sizes. So some people are a better fit for an off-the-shelf knee, other people aren't. And so how better to match someone's anatomy than to match their anatomy by making the knee replacement specifically for their size and shape and dimensions. So this is a conformis knee replacement. It's kind of very interesting that the medial and the lateral joint lines are treated independently of one another. So most off-the-shelf knee replacements are collinear, meaning the medial and lateral compartments are exactly the same height. This is the only knee system that has different heights of the medial and lateral compartment. So I've been doing this since 2016. My patients have loved it. I've seen improvement overall from when I was doing knee replacements from another vendor that was not conformis. And so I've stuck with it, and I've got lots of happy patients that have had great results with the conformis custom knee replacement.